Good evening, everyone. So once again, we are here back with the latest session regarding CKD and dialysis, which is a pertinent problem in today's healthcare scenario. And today we had our guest speaker, is none other than Dr. Ravi Ranjan Shah Mundal, who is currently working as a consultant nephrologist and transplant physician in the Mission Hospital, Durgapur, with a vast experience in the field of nephrology and transplant medicine. He has also worked as an assistant professor of SRMS NH Durgapur, BR Singh Hospital, Amri Salte, Kolkata. He has having a publication on national and international journals. So, with this note, I would welcome Ravi sir to uh, be with us in this today's session. CKD and dialysis, what are the common things? What kind of experience people are having? If you can start off with. So, I request you to start. What are the symptoms and what people are usually ignoring in the early stage, if you can say?
So at the outset, I'd like to thank KAHO and Patient Safety Foundations for giving this opportunity to speak in front of the learned gathering and the audience regarding this awareness program on chronic kidney disease. So what is chronic kidney disease? It's a kind of kidney involvement either by structural or in the functional mode. And which is persistent for more than 3 months. So these kind of kidney diseases, chronic kidney diseases, are basically asymptomatic at their initial stages. So people often don't find themselves that they are having a kidney related problem. Usually they present to us with subtle symptoms like nausea, vomiting. It can be loss of appetite. It can be sometimes swelling in the lower part of the body, in the legs. Sometimes patients feel that they are passing less amount of urine, or sometimes it can be so they are passing more frequent urine. It can be a presentation like a pain in the flanks or in the abdomen. It can be passage of blood in the urine, and many other subtle signs and symptoms which can often be ignored or missed by common people unless they are being clinically assessed or judged by physicians. So these kind of diseases are to be treated very cautiously, and they have to be monitored. Especially certain investigations, they can help us identifying which sort of kidney disease this patient is suffering from.
Who is at the highest risk of developing CKD in India today, in today's scenario, what we can say?
So, kidney disease can involve at any age any age. So it can be. It's not that it only involves the elderly patients or population or adult patients or population. Even children can have kidney diseases. There are many kidney diseases which can be familial or genetic, and they can present at very early age also. The things which are mostly predominant in present day kidney CKD patients in India is presence of diabetes. This is the most common cause of kidney disease in India. Around 60 to 70% of the total CKD populations are basically because of diabetes in India. Other than diabetes, it can be hypertension, it can be underlying heart diseases, it can be underlying liver diseases, it can be per se because of the glomerular diseases like involving the kidney itself. It can be secondary to stone diseases or cyst diseases like multicystic kidney disease or autosomal dominant polycystic kidney disease. So there are many kidney diseases which have their different presentation at different age groups. If a patient is having diabetes or hypertension, they are certainly in higher risk groups of having chronic kidney disease. The duration of diabetes is most important, as well as how they are being controlled in last decade. So both are very important. If the diabetes duration is longer or the control is not good, in those situations, these patients can have a tendency to have chronic kidney disease. Specifically, if a patient is having a family history of diabetic kidney disease, they are again in the very high risk group of chronic diabetic kidney disease. Uh, Likewise, hypertension also is a well-known risk factors. In long-standing hypertensive patients, they can have hypertensive nephropathy or chronic kidney disease as the age progresses. So often we see that a patient of very young age who has recently been diagnosed to have chronic kidney disease in advanced stages, and he is hypertensive. So they are being asked whether this hypertension has caused kidney disease for him. So these are basically situations where the chronic kidney disease itself has caused hypertension in this group of patients, which is known as secondary hypertension. A long-standing hypertension leading to chronic kidney disease usually presents in elderly age group.
Agreed, sir. This is a common phenomenon what I we usually encounter or observe. So, sir, my next question to you: what habits silently damage the kidney? If I say if we can control those habits from the early stage, like low salt, low water, avoiding painkillers, what can help so that it can be prevented to somehow extent?
Yes, definitely there are certain risk factors like over-the-counter medications, specifically painkillers. So often we see patients who are suffering from kind of arthralgia, joint pain. So these sort of patients used to have over-the-counter painkillers for years. So they can have the propensity to develop chronic kidney disease. Likewise, patients having some kind of alternative medications, maybe Ayurvedic medications, sometimes they can have some ingredients which can precipitate chronic kidney disease, and the disease can be of progressive nature. We have to avoid over-the-counter medications. It should always be taken under supervision of a physician, and we have to monitor the renal function whenever we have to take long-standing painkiller medications. Likewise, patients who are having diabetes and hypertension, they have to change their lifestyle. Lifestyle modification is one of the most important factor how we can prevent chronic kidney disease. Like daily activity or exercises of around 30 to 45 minutes, at least 5 days a week. It's very important to have so to avoid the chronic kidney disease in these kind of patients who are having comorbidities like diabetes and hypertension. So lifestyle modification is very important. Uh, we often need to emphasize that drinking water is one of the most important factor to prevent dehydration induced kidney injury. So whenever we are talking about kidney disease, we always ask to prevent kidney disease, you have to drink much water or plenty of water. But at the same point of time, if we are already having chronic kidney disease, we should be cautious about the water intake, because excess water intake in advanced chronic kidney disease can be hazardous, and these patients can have breathlessness as a symptom and volume overload. So we should be cautious about the intake of water and should be adjusted by the physician concerned.
Okay, sir. So, sir, if I ask you what are the red flag symptoms, that means a person should immediately go for kidney test immediately.
Okay. So, any person who are having these kind of comorbidities, diabetes, hypertension, lipid profile abnormalities, or who have long-standing high uric acid levels on medications or on and off medications, who has past history of passage of stone or stone disease requiring surgeries, patients who have past blood in urine like hematuria, or a patient who are recently developing signs and symptoms like progressive shortness of breath, progressive anemia requiring blood transfusion, a patient who is passing less urine, who has recently passed hematuria or blood in urine. So these a patient who is having palpitation and chest pain. So these can be certain signs and symptoms which may be a sign of advanced renal failure. So at this point of time, we should not waste time. We should always come to physician and nephrologist preferably and do certain tests to identify at what stage of the disease is there.
And so this is prevalence across any age group. This red flag symptoms.
Yes, yes.
It can be it can happen with any age group of
Yes,
population.
this kidney disease can be a presentation, or advanced renal failure can be a presentation at any age group. It can involve children, it can involve the adolescent, it can involve young people, it can involve elderly population. So the age doesn't matter. Whenever we are encountering these kind of signs and symptoms, we should always rush to the physician.
Right, right. So, sir, what are the simple tests we should usually do regularly to keep a check on this?
Commonly, routinely done investigations are serum creatinine. So this is the most important parameter to find the kidney function status. Likewise, we have cystatin C and other parameters, but we usually do not recommend on day-to-day basis. We also suggest to do urine examinations to find out whether the patient is passing protein or blood in urine. So this is one of the most important investigation. GFR, the glomerular filtration rate, that can again be tested in a lab, measured, or that can be estimated by using other parameters like creatinine or cystatin. So it's not always necessary to have a GFR test. We can calculate it down from the creatinine level. We should ask for ultrasonography or imaging testing to know the kidney structural abnormalities also. So these are the routine tests. Other than this, routine tests like if the patient is having diabetes, so that has to be checked. If the patient is having other comorbidities like hyperuricemia, high uric acid level, or dyslipidemia like high cholesterol, triglyceride, or LDL level, so they should always be checked simultaneously.
Got your point, sir. So, sir, my next question to you is, at what stage do you think kidney damage is reversible?
By definition, chronic kidney disease is actually reversible. But at the very early stages, like stage 1 or 2, when our GFR is more than 60, in those stages, the disease can have a situation where we can treat them. If we treat them early, they can be reversible to some extent, but not always. CKD by definition is progressive disease, but if we identify at the stage of early stage 3, or maybe late stage 3, even in those cases, we can treat them likewise so that the patient doesn't progress to end stage renal disease in a short duration of time. The treatment aim or goal changes as we identify them in the late stages. At those stages, the treatment goal doesn't remains that to reverse the disease, but to retard the progression of chronic kidney disease so that the patient doesn't end up in end-stage renal disease or requirement of dialysis or transplant. That remains the goal in late stage. But of course, in the early stages like stage 1, 2, or early stage 3, we can treat them so that the disease can be reversed.
So, why CKD now is the fifth leading cause of death in India?
Itself is a very difficult to identify in the early stages. That is the most challenging task for patients as well as the physicians to get the disease in their early stages. Secondly, whenever we are having chronic kidney disease, these diseases are always there for the rest of the life and they remain progressive disease. So these patients has to be treated in a very frequent manner. Like we have to ask them to come back with certain tests at certain interval and to monitor certain parameters. We have to change the lifestyle and they have to follow the strict dietary modifications what they have been given by the dietitian or the physician or the nephrologists. And they have to take plenty of medicines. So polypharmacy is a very difficult to manage in those chronic kidney disease patients because they have plenty of things to be modified by medications so that the disease remains stable and the patient remain asymptomatic. So these kind of polypharmacy is often very difficult to handle by the patients themselves. So they had to take 8-10 medications per day. So that is a big challenging task. And in advanced stages of kidney disease, the dietary restriction as well as the fluid restriction, often patients fails to follow. So that's the most important thing. If the patient doesn't follow those things, it's very difficult to manage the situations and they often land up in emergencies in hospitals and in a difficult situations to tackle the complications of chronic kidney disease.
So, sir, when does a patient actually need dialysis? What are the what leads to that stage? What are the triggering factors that it lead to finally to dialysis?
Okay, so dialysis is required at the end stage of renal disease, ESRD. So we say ESRD is when the patient has reached to stage 5 chronic kidney disease, when the GFR is less than 15. Okay, and the patient is having certain signs and symptoms of advanced renal failure or a very high urea or creatinine, like loss of appetite, like nausea and vomiting, breathlessness, and sometimes patient can have chest pain also. They can be deliriant or restless, and sometimes they can have certain bleeding manifestations from certain sites. So these are the signs and symptoms of advanced renal failure or end-stage renal disease. If we do investigations, if these kind of patients are having metabolic acidosis, so building up acids in the body, or the toxin levels are getting very high, if the patient is having hyperkalemia, high potassium level, which often can lead to heart ailments. So if these are present, then we have to take the patient to dialysis. Volume overload, very accumulating fluids in the body, heart failure, accumulation of fluid in the lungs cavity. So these are the situations where the patients often lands into emergencies, and we have to take them to dialysis. So these are the situations where we should immediately start dialysis. The dialysis can be of initiation can be of emergency initiation of dialysis, or it can be a routine or chronic initiation of dialysis if the patient remains stable and we are planning for dialysis for the rest of the life. Uh, uh, Most of the chronic kidney disease patients progresses to end-stage renal disease because often we fail to control their dietary restrict diets or the lifestyle modifications they often fail to comply with or adhere to, or the medications which we are giving them, they are not very adherent to that medications. A good communication between the patient and physician, we can take care of those situations so that they can handle the situations well, and we can treat them to prevent their progression towards end-stage renal disease.
My next question to you, sir, is dialysis really scary, painful, and life-ending?
Dialysis is definitely a painless procedure, and that is to increase the lifespan of the chronic kidney disease patients. We have to admit that if we don't do dialysis for the end stage renal disease patients who are getting critically ill in next few months or within a year, or are having to have some complications in next few months and year, they are going to die. So this modality of treatment can help them to increase their longevity, the lifespan, and they also can prevent them from having severe anemia, from prevent them from having heart diseases, and they can have a better quality of life if they are choosing dialysis rather not to choosing.
So it's kind of a life-saving
So this is a
technique.
life-saving procedure. Definitely that have some complications which can happen in certain patients in certain situations, but that can be handled well by the nephrologist concerns or the technicians involving in the caregiving approach. So that's not it's not fair to say that dialysis is a painful procedure and it should not be done. It's always welcome for the end stage renal disease patient to increase their lifespan.
How does the dialysis help a person to continue living despite of kidney failure?
So whenever we are starting a dialysis to a chronic kidney disease patient, they should continue dialysis for at least twice or thrice per week basis. Uh, they have to come to the dialysis center for twice or thrice per week. But there are second mode of dialysis, which is known as peritoneal dialysis, that can be done at home also. So we introduce a catheter into their abdomen, and they can introduce fluid into the peritoneal cavity or the abdominal cavity through that catheter and remove it at after a certain time. They can do this procedure at home also. This is known as peritoneal dialysis. So that can be done at home also. We have a process to teach the patients and the caregivers at their home, and they can do it at their home. And the patient often remains very good at peritoneal dialysis. If we are talking about hemodialysis, yes, they have to come back to hospital at certain interval, like twice or thrice per week basis. But whenever we are starting dialysis, there are certain changes in their diet. So diet restriction becomes less if we are putting the patient on dialysis. If they can enjoy their life with less dietary restriction, but some certain restrictions still remains. We have to control their comorbid conditions like diabetes and hypertension and others like anemia, or if there are any heart diseases or bone diseases, that has to be taken care of by medications. And they can continue dialysis and they can live their normal healthy life also. The restrictions which remains even on dialysis are fluid restriction. They have to restrict their fluid intake to uh, say around 800 to 1000, 1200 ml per day, according to the situations, patient's conditions, their heart disease conditions, etc. But fluid restriction remains. Salt restriction is one of the most important thing. We have to restrict dietary intake of potassium and phosphates. So they are to be taken care of by us physicians or the dietitians involved in the patient's care. Allow them to have more proteins during the dialysis. So dialysis are the sessions in every dialysis sessions. There are certain amounts of protein which is coming out of the body by the process of dialysis. So we have to give extra amount of protein so that there are no malnutrition, or there is no sarcopenia or the muscle wasting, and the patient remains stable, well, and healthy.
Okay. And sir, last question to you is that if a patient on dialysis, can they freely walk, travel, and live a normally family life?
Yes, they can travel to any part of the country, provided they can have access of dialysis at the point they are reaching to. So they have to take dialysis. Maybe a patient who is on twice per week dialysis, they have to take at certain that definite interval. So dialysis sessions should not be missed, but at the same point of time, it's not that they should be
Restricted from their
restricted.
work or daily
Yes,
activities.
yes. So they should have access to dialysis whenever they are traveling to a certain other cities. It's better to communicate with certain centers or dialysis center at that place and the physicians over there or the nephrologist, and they can take the dialysis during their travel or stay at that city or places.
So as a closing note, sir, what are the three takeaways, if you can say, what we can follow as a patient and patient relative?
So the most important thing is it's very difficult to identify chronic kidney disease in their early stages. But it's not that we can't diagnose them. For subtle certain signs and symptoms, we have to go to the physician and check definite parameters to identify the chronic kidney disease. If they are being identified at their very early stages, even if the disease is progressive, we can treat in a manner so that the disease progresses very slowly towards the end-stage renal disease, and they can have a very healthy life with a very good quality of life. So this disease is often not reversible, but it's always better to identify them at their very early stages so that we can prevent them to progress towards the end stage renal disease.
Yes, sir. So thank you so much for highlighting all the known and unknown fact. I hope it will be beneficial when we are going to air this session and help a lot of patients to take necessary precaution, and who all are suffering, it will benefit a lot from your advice. And so I wish a healthy and life to everyone. Thank you so much, sir.
Thank you. Thank you.
These doctor-patient conversations are brought to you by CAHO and Patients for Patient Safety Foundation. CAHO is the consortium of accredited healthcare organizations established to promote quality, patient safety, and accreditation. As healthcare providers, we wish to partner with patients and educate them about the common disease conditions, symptoms, so that they become empowered partners. Towards this, we have partnered with the Patients for Patient Safety Foundation to bring to you doctor-patient conversations.
Thank you, ma'am. Patients for Patient Safety Foundation, established, as you know, by CAHO, focuses on patients, families, caregivers, and lay people who are unaware that they can engage and provide equal partnership in healthcare outcomes. We do this by creating suitable, simple patient education material which highlights early symptoms for early detection and better cures, including the risks and consequences if these are ignored. But there is hope because we also provide tips for actionable protection and preventing of all such harm. Towards this, we bring you this series of conversations which addresses doubts and fears that lay hidden in a patient's mind, but experts, doctors clarify these, providing well-timed information for self-engagement. We do hope you build this partnership with the healthcare providers, and remember, our health is our responsibility. Thank you, and keep watching these episodes.